Just briefly, when my son was born, one of the first vaccinations he got was Hep B in the hospital. Do you know what the rate of newborns getting the vaccines are?
At this point, it's a policy. It should be universal at this point in the United States. In the United States, everyone. I think the change happened in the mid-'90s or so, but essentially everyone gets a vaccination. It's a 3-step vaccine, so usually it's the first step is in the hospital, and then a month later they get one with their pediatrician, and then 6 months of life they'll get their last one. And in general, 90% of patients or little kids that get the 3-shot vaccination series will be immune. But, kind of taking a step back prior to that, if mom already has hepatitis B and she has a high virus level, baby may already have hepatitis B, so the vaccination may do nothing at all. So, there is some new data, out there, showing that if moms are treated with an antiviral medication, if their virus level is greater than 200,000, then that decreases the risk of baby getting the virus. And then you vaccinate at that point to prevent.
Well, thank you very much, Dr. Pan.
So I know I appreciate Senator Waldron bringing up vaccination, and clearly that's one of the strategies that we've been able to do to reduce, I believe, hepatitis B prevalence by 90% in young people. However, while you made mention that vaccination is maybe universal, that's maybe the policy, but we also know there's people spreading misinformation about vaccines and scaring parents, and we have parents saying, well, I don't want to get my child vaccinated because, after all, they're not going to have sex or use drugs.
Right.
Right. Now, maybe you can speak to, I had mentioned earlier in my opening statement that we actually documented prior to vaccination 10,000 children a year got hepatitis B who are under the age of 10. So the likelihood of them engaging in sex or drugs are, I think, relatively low. Right. And who were born to Hep B negative mothers, so they couldn't have gotten it from the womb. So can you speak to perhaps other forms of transmission than sex and injections? Right.
So vertical transmission is probably the most common method of transmission worldwide. Worldwide. For example, in China, East Asia, if mom has a high virus level, she doesn't get treated. That's how you get it. In the United States, we're seeing a lot of probably what will be more this horizontal transmission. Maybe they have a family member with hepatitis B. They're living with that family member, and they're sharing a lot of these things, whether it be, they're coming in contact with maybe a nail clipper or a razor or something like that, and they're getting in contact with someone's blood. But no one knows that the uncle or the family member has hepatitis B, so and it's a relatively silent illness. So that's how most likely these kids get these viruses, this horizontal transmission. So that kind of speaks to more, we need education. We need to screen these patients who have these who have hepatitis B but don't know it, so they can prevent transmission to others, prevent poor outcomes for themselves. So I think that horizontal transmission, we see that a lot.
And can you speak to the safety of the vaccine?
Very safe. I haven't seen. The only thing that's potentially that could be harmful is just the pain from the shot. But I haven't seen any poor outcomes from it. There's not a lot of the allergens in that particular vaccination, like an egg allergy or something that you may see with other vaccines. So we should get it. Especially if you have relatives from an endemic area, just to prevent transmission to others and yourself.
So you would strongly recommend that every child get vaccinated against hepatitis B?
Absolutely.
Thank you, sir.
Thank you very much. I have no last questions. We want to open it up for public comment that the public may want to weigh in on, give them opportunity to give some comments. We want to limit your comments to 2 minutes, and we hope that there are just brief, succinct comments in terms of what we've heard to hear today. And so we want to make that opportunity available to you using this microphone. So if you have any comments, we invite you to please stand, state your name and you have 2 minutes.
Hi, my name is Del Bigtree. I'm curious about why we're not hearing much about education, because it seems like the reduction in HIV and AIDS that we talk about really comes from an education of lifestyle, things like that. We don't have a vaccine for AIDS, so that's my first comment. And secondly, I'd like to discuss, it's been widely reported that we have the highest infant death rate in the industrialized world. More babies die in the first day of life in America than every other industrialized nation combined. And then you look at the fact that we're one of the only nations giving a Hep B vaccine on day one. And I'm just curious why we're not looking closer at that. And then specifically to the fact that the Hep B vaccine was only tested for 4 days in its pre-licensing phase. And so I know we make comments that the vaccine is safe, but I'm curious how they've determined that, especially given that the load of aluminum for a healthy baby is supposed to be 30 micrograms, and that vaccine has 5 times that at 225 micrograms. So all these things add up to me as something we should be really investigating, because I honor the fact that we have a hepatitis B and C issue, especially amongst, people of color. But we have to be looking at, are we safely handling this? And given that so many babies are dying in our nation with the best hospital system and the best doctors in the world, why aren't we looking at this vaccine closer and deciding maybe it's not a good idea to be giving a vaccine to a day-one-old baby for something that is transmitted via sexual contact or sharing needles? We also know that the vaccine wears off after 6 years, so it's going to be totally irrelevant in this child's life at the point they're going to come in contact with hepatitis B.
10 seconds.
10
seconds.
Okay. I'd also like to point out that you mentioned 10,000 children, I don't know where that number comes from, have gotten the disease without a mother that transmits it, but you didn't really bring any facts on how that would be, and that actually is 0.0001% of 74 million children in this country. So are we using a dangerous vaccine for no reason whatsoever?
Thank you very much for your comments. Is there another for comment? Please state your name for the record.
Sure. My name is Christina Hildebrand. I'm from A Voice for Choice Advocacy. I also wanted to speak to the efficacy and the safety of the vaccine. Again, I think it's very serious that somebody here said that it was completely safe and that every child should get the vaccine. That isn't the case. We know from the package inserts that there's a huge long list of things that can happen to you, including hepatitis B symptoms. And so I would say, and one of the other contraindications, or one of the things that it states in that package insert, is that you should, if you have a sensitivity to yeast, you should not get it. And I would say that at 12 hours old, how do we know that any baby has a sensitivity to yeast? I also, just citing some studies, and I have these for you if you'd like them, there's been studies done on mice that show that there's a gene expression after hepatitis B, and it found that 7 genes changed, which reflected a subtle liver injury as a result of subtoxic adverse effects of the hepatitis B vaccine. As you know, the USA vaccinates babies for hepatitis B that are hours old, and so therefore any liver injury in these vaccinated babies could be another non-specific effect created by the epigenetic modulation. And so in general, there are many other studies. Obviously, I only have 2 minutes, but I would say there have been, if you look at the facts,
30 seconds.
Since 2000, or up until 2015, September 2015, there have been 710 claims filed in the Federal Vaccine Injury Compensation Program, 54 deaths, and 656 serious injuries. There have been 11,052 serious adverse events reported in VAERS, which is the vaccine adverse reporting system in connection with the hepatitis B given since 1990. These are all numbers that are serious numbers with relation to this vaccine, and I would like for you to look at, whether we need the day one vaccine and whether it's waning, and how many of those people that, you say that there are 10,000 children who have, under the age of 10, who have hepatitis B. I'm pretty sure the majority of those got the vaccine. So what's happening with the vaccine? We don't have research on this vaccine showing the efficacy and the safety.
Thank you very much for your comments. Appreciate it.
I just wanted to list maybe some of the adverse reactions that are on there, since the only thing that was mentioned was
What's your name, please?
soreness at the injection site. Joshua Coleman. Okay. I'm seeing things like a lot of things I can't actually pronounce. Anaphylaxis, encephalitis, encephalopathy, migraine, multiple sclerosis, hypothesia, conjunctivitis, seizures. I mean, the list goes on and on and on. There's a whole list of adverse reactions that come on the vaccine insert. So it's odd that it's not being brought up, but there are a lot of issues that can come from being vaccinated.
Thank you very much.